This is our case study presentation on abortion rights. You can go over to the next one. So this is the current landscape of abortion rights. This displays all the states in our country, displaying which states are most restrictive towards our abortion rights versus the ones who are most protective. So on December 1st, 2021, the U.S. Supreme Court heard the Mississippi case, Dobbs versus Jackson, potentially weakening the Roe versus Wade protections. There were 108 abortion restrictions enacted in 19 states in 2021. We can go over to the next one. So here we have the necessity of later term abortions. So people seek later abortions because of financial issues, legal challenges, and personal changes. And the reasons for late abortions is that many face financial and legal barriers or unexpected life events. There was unchanged demand. Restrictions don't decrease the need for abortions. So some key factors were that common drivers are money issues, law, and personal changes. The consequences were that tighter rules meant longer travels for care and more strain on out-of-state clinicians. So, yeah. New York State as a model. So here you can see New York permitted abortion in 1973, years before Roe. So despite our early leadership, there was divergence between state and federal laws post-Roe. The state limited care after 24 weeks while recognized broader conditions for late-term abortions. So New York has always been a pioneer permitting abortions in 1970, significant 3 years before the landmark. Okay, so yeah, the legal gap had tangible consequences. Many individuals found themselves making challenging trips to states for the care they needed. Over the years, relentless advocacy and medical collaborations and sought to close this gap. Initiatives were developed to understand care accessibility and reinforce referral networks. And yeah, today, with the Reproductive Health Act of 2019, New York reaffirms its commitment to abortion access and NYC Health, and hospitals exemplify how policies can be effectively transformed into robust healthcare practices. And go ahead. So here we have the innovations of Reproductive Health Act in 2019. So abortion shifted from a criminal issue to a healthcare matter. So they expanded care providers, so empowerment of advanced practice clinicians, and they ensured access up to 24 weeks and beyond in specific scenarios. So diving deeper into the Reproductive Health Act. Firstly, this act shifted. I did say that. And yeah, collectively, this legislation reflects a commitment to reproductive autonomy and recognizes the varied circumstances individuals face.
So, case study in New York City Health and Hospitals. New York City Health and Hospitals is New York's public healthcare system, and it is the largest one in the US. It includes 11 hospitals, 5 long-term care facilities, and more than 100 community health centers. They provide several forms of care, including inpatient, outpatient, and home-based care services to more than 1 million residents of New York. And their healthcare system recognizes abortion as an essential and necessary part of care. And the main issue with their healthcare system is that many healthcare professionals were unaware of the legal parameters surrounding abortion after the reproductive healthcare was put in place. This could be due to abortion policies changing a lot throughout the years, which is can make it like confusing on the current legal parameters. And New York City Health and Hospitals clinician advocates and policy advocates aim to expand abortion services that align with the Reproductive Health Act. And communication, there is a lot of lack of knowledge among patients and physicians. There is low clinical awareness about abortion services. However, clinician advocates have worked with hospital communications to better inform patients. In some ways, they have tried to spread more knowledge about the current legal parameters and abortion services are by updating information on websites, social media, and printed out materials. And they have also conducted presentations on the Reproductive Health Act to better inform physicians and the healthcare staff on the current abortion services available, and system-wide policy on abortion updated to align with the Reproductive Health Act. And the overall goal for the healthcare system in terms of communication is to spread awareness on New York law and abortion rights.
Enhancing procedural skills. First is to take definition two, the development and implementation of training for physicians on administering injections. Abortion services relied on maternal medicine specialists to perform this procedure. Secondly, they focuses on expansion of surgical skills needed to provide better abortion care. Physicians have been credentialed at multiple sites, allowing practitioners at their facilities to provide support for skill expansion outside their home. Side note, having a trained clinicians who provide abortion services that are able to administer the procedures across pregnancy spectrum will solidify access to later abortion care within the healthcare system.
So prior to the changes made to the referral system, some of the obstacles that the institutions were facing were that there was not really an effective communication pathway allowing for patients to have timely referrals. On top of that, there was also there lacked a central pathway for external healthcare professionals as well. So meaning that if they wanted to go receive help outside of this institution, there was really no clear direction on how to get them that help. And furthermore, there was also a lack of just seamless connections of financial support. So if someone was in need of financial help to access these services, there was really no way on how they could be directed toward that too. So with that in mind, they made some current changes. One of them was their new referral system. Within this new referral system, they integrate a patient's geographic location. So meaning that inputting their geographic location, they're able to find where they can locate services more locally to them easily. And they also created a new position called the Client Navigator. This position, its primary role is to accompany the patients who need both either logistic or financial help during these times, and just ensuring that they're being sent to the correct sources. And also this Client Navigator supports healthcare professionals within the institution and outside as well. So depending on if a patient is seeking referrals or they just need help with the patients in there. And they also have worked to expand the financial support. So their goal was to gain more financial support for the patients. So they have been liaising with abortion funds just to increase the financial support for the patients.
And how does this connect to health equity? So first, New York law and the Reproductive Health Act strengthen abortion rights, and it allows anyone who's seeking abortion safe and equal access, and it allows those seeking abortion to access up to 26 weeks of gestation.
And to conclude our presentation, just to kind of touch point on some of the points that my peers shared, overall, they aim to provide a better, more and clear, concrete information towards the patients, as they did find that many of them did not have the best information being provided. So they did that, through the presentations that were being offered and updating their websites and all of that. Furthermore, they did add 2 more institutions that provide more abortion care. So there is more providers there that have increased that abortion care to the patients themselves. With that in mind, the number of clinicians has as well increased. With that, we see 10 new providers within these institutions, and overall, the new systematic guidance with the updated referral system and the new position of the client navigator. So with these changes, they do seek to not only expand the abortion care and the information being provided to the patients, but overall make sure that every patient that does need this service is being treated as effective and immediately as possible, as it is a critical thing and urgent matter to be attended to. Thank you.
And here are our citations. Thank you. That concludes our presentation.